only milk diet in cancer patients. Keeping the patient on milk diet is a novel approach for cancer. The basic logic behind this is the rasayana, or the rejuvenation of the body tissues. After all, the body is made up of food material, and if we restrict food to a rejuvenating factor like milk only, clinically the whole body tissues change. As discussed earlier, cancer is just not a local disease. It is a local manifestation of a systemic disease. A supreme rejuvenating medicine in the form of diet is most ideal for this. According to Ayurved, it enhances immunity also, and the process of generation of malignant cells ceases. The patients can get cured. Even then, other factors also influence for aggravation, regression of the disease. If the patient has already undergone surgery, FNAC, biopsy, then there is a greater chance of fast growth of malignant cells. Fear, anger, depression is also aggravating factor. Whereas patients with a positive attitude, hope for cure and diagnosed without FNAC and biopsy respond better, and there are greater chances of recovery. Milk has another advantage as well. It is a complete diet, so there is no need of any other diet. I have kept patients on only milk diet up to 9 months. Since it is in liquid form, it can be easily taken even in esophageal cancer or those patients who are fed by feeding tube. It is easily measurable, so that one can easily measure the quantity and observe it for a prolonged period. Fresh organic cow's milk is the best option. If fresh is not available, one can go for pasteurized organic cow's milk. It is better to avoid milk of a hybridized cow. Hot or lukewarm milk is preferable. A pinch of turmeric may be added to the milk every time. Sugar is not required, but if somebody wants to use it, brown sugar is better option. Honey can also be a good option, but then the milk should not be hot. Very rarely people face complications or side effects like flatulence, loose motions or excessive cough. Generally, the symptoms subside on their own. A pinch of dried ginger powder along with milk helps in all these problems. Advice from a medical professional can be taken if needed. In spite of these many advantages, many people are afraid even to hear the concept of only milk diet. They should be convinced and then only start taking milk diet with the determined, happy mind. It is really a wonder that people accept chemotherapy and radiation as treatment without any hesitation. Compared to that, milk diet is a joyful thing, but they are reluctant to it. People who are not accustomed to milk should increase the dose gradually. It is very well seen even in terminally ill patients that if the patient is able to drink and digest minimum 2 liters or more milk per day, then the patient definitely survives. At least the life is extended with better quality. Generally, within 3-4 days or maximum 7 days, patients drink this much quantity. Then the progress is good. But if the quantity remains less, the prognosis is poor and many a times the patient expires. So you can judge whether the patient is going to respond or not within 7 days. By only milk diet, it means that one should drink only milk and not any other food or fruits or something else. Whenever the patient feels hungry, she should take milk only. I have experienced in many cases that even in terminal cases, the therapy works very nice. I honestly request to follow this treatment. Commencement of Ayurvedic treatment. According to Ayurved, treatment in short is avoidance of causative factors. Let us take an example of a vehicle. If the vehicle is not showing proper mileage, the mechanic will search for causes such as improper quantity of the fuel, choked spark plug, improper setting of the points or improper handling of the vehicle. Then the only proper action can be taken to improve the average. Unfortunately, in modern medicine, the causes are either not found out fully or they aren't given much attention in considering treatment. Because the treatment is based on cell type, irrespective of its causative factor, such as tobacco or stress, etc., and is rather mechanical. As a consequence, the causes continue and so also the progress of the disease. The generation and continuation of a disease is dependent on the causative factors. Here in cancer, there are varieties of causes as mentioned earlier. Hence, it is important to consider all causes like stress or depression even for treatment. Developing a positive attitude to fight the disease is itself a treatment. Considering all factors like food, lifestyle, addictions, stress, etc., holistic management at an individual level is required. This is an expert job. Though I am handling many such cases for last so many years, considering the need, much larger efforts are required. So I have now established Niramaya Ayurved Academy and I am commencing certificate course in the proficiency of cancer, heart disease and diabetes in Ayurvedic perspective. The purpose is to create eminent Ayurvedic practitioners to handle these diseases successfully. I will be sharing my knowledge and experiences in this. It is expected that they all start Niramay Ayurvedic holistic management centers across the globe and serve the humanity. Emphasizing on these diseases, one can easily find their contact details under mapping of services in the website www.gadgilayurved.com. One can even find service providers like yoga teachers, massagers, counselors, etc. besides Ayurvedic physicians. At least one can have some kind of support anywhere in the world. Those who can avail full-fledged Ayurvedic holistic treatment will be fortunate. The others may at least follow the following guidelines of Ayurvedic approach. 1. Follow the rules described in daily regimen such as eat only when you are really hungry, etc. 2. Have a regular massage. 3. Regularly practice yoga. 4. Switch over to only organic milk diet or at least healthy food. 5. Create and keep a positive attitude for the cure of the disease. 6. Observe aggravating and relieving factors and act accordingly. 7. At least aim at better quality of life with prolongation in advanced conditions. 8. Spread the message of Ayurvedic holistic management right from the beginning of the disease or at least in the disease-free state. 9. Full-fledged Ayurvedic treatment is available in my clinics and in the clinics of the service providers listed under mapping of services one may contact directly in the clinics. These guidelines will definitely help the patients to a certain extent.